This is Lecture 4, which will primarily cover personality assessment, which corresponds to selected sections of Chapter 8 of your textbook, plus some additional material, plus a brief section on intelligence assessment. Announcements and reminders. Homework 4 is due this Sunday at 11 p.m. And this week, you are going to read Chapter 8. You can skip the section on thematic apperception test, the TAT, on pages 242 to 244. The lecture also has additional information on the personality inventories in the DSM-5, which is not included in your textbook, so please pay special attention to that part of the lecture. And then the lecture has a brief section on intelligence assessments at the end of this lecture. And this information is included in Chapter 7, which is not part of your assigned reading, and we're not going to cover Chapter 7 in this course. You're more than welcome to read Chapter 7 if you're interested in intelligence assessment, and I'm happy to answer any questions about that. But as for the material that you're responsible for, just listen to the section I cover at the end of this PowerPoint. Exam 1 will be posted on Monday, the 8th of October, and it'll be due on Sunday, the 14th at 11 p.m. This is a timed exam, and I'll tell you what the time limit is after I finish writing the exam, but it'll probably be something like either an hour or an hour and a half, so you will still need to study, but you can use your lecture, the book, or your own notes. You must complete this exam alone, so if you have a friend in the course, please don't complete it together. It's going to cover materials from weeks 1 through 4, which is lectures 1 through 4 in chapters 1, 5, 6, and 8. And please note that homework 5 will be due at the same time, so please carefully budget your time so that you are not turning in both at the same time. Okay, getting into the course material, this is going to be a lecture mostly on personality assessment, as I mentioned, but also some intelligence assessment at the end. In personality assessment, we mostly talk about objective testing versus projective testing, and they each have their own benefits and drawbacks. First, we're going to cover objective testing. So objective personality measures have a fixed set of responses that are possible, and this can be assessed in a number of different ways. So it can be true-false questions, yes or no questions, or dimensional scaling, which is also called a Likert scale. So if you look at the image down on the right, there's a range of answers that goes beyond yes or no. It kind of gets a little bit more information and a little bit more nuance, so you can answer on a scale, for example, of 1 to 6 or 1 to 10, with 1 being most strongly disagree, 6 being most strongly agree, and that's considered dimensional scaling or Likert scale. Advantages of objective testing, it's economical in that it's typically relatively easy to administer. So it's possible to test in large groups. You just hand everyone an objective test and they fill it out. It's usually paper and pencil. It's possible to score it and administer it on the computer and sometimes even interpret it through the computer, although there's some controversy about computer interpretation. Objective testing can cover a single dimension, such as like an introvert-extrovert dimension, or a trait, which might have a number of different dimensions, so something like depression. Objective testing is usually pretty straightforward, scoring and administration-wise, and in terms of taking the test. And they are objective, as is in the name, and usually pretty reliable, meaning if somebody were to take an objective test now and take an objective test in maybe a month, usually you would get pretty similar scores. As well, too, clinicians rating a single objective test are going to get similar ratings. They probably should get exactly the same ratings, actually, depending on the objective test. Some disadvantages of objective testing, however, are that questions might be uncharacteristic of the respondent. There might be a question, there's a question on one objective test, which is like true, false, I like to read mechanic magazines. And if you've never encountered a mechanic magazine, you may not know what that means. And many people in the world have not encountered mechanic magazines. And so by asking questions that are so specific, you can kind of alienate certain individuals or not. The questions can be something that don't apply to everyone. Another disadvantage of objective testing is that the reason for the behavior that you are assessing is not necessarily evident. So again, in the example of the objective test that has the item, I like to read mechanics magazines, you don't know why that person likes to read mechanics magazines. Maybe it's because they like mechanics and they're a mechanical person and kind of think in terms of like tools and processes, or maybe it's that there are mechanic magazines in their house and they don't, they want something to read and that's what they read. Another disadvantage is that you only get one overall score. You usually get subtest scores too, but you get a limited number of scores from objective testings, and this may not be fully representative of mixed complex behaviors that personality actually comprises. As well, participants can only provide limited information, so they can say yes or no. They can respond on the Likert scale, which has a little bit more information on that dimensional ratings, but they can't write in additional information. There's a set number of responses. As well, people can purposefully give incorrect answers, and we're going to talk about that later for a variety of reasons. People might give incorrect answers. There can also be misinterpretation of questions, and usually because objective personality tests are self-administered, meaning the individual being assessed is filling it out themselves, they may not have the opportunity to ask more, or you as the assessor may not have the opportunity to really ensure that somebody understands all the questions. To understand how to properly use objective tests, it's important to understand how tests are constructed and all the considerations and different models that go into constructing objective tests. Before I get into the different models, I want to validate anyone's confusion with this area of the chapter. I think it's complicated material. Entire graduate level classes are built on this material and on understanding psychometric tests and test construction. So please don't feel frustrated if the material is a bit confusing. Just do your best to read it through once or twice, and please ask me questions. I also won't ask too many nitty-gritty details, especially about the statistics underlying test construction. I just want to give you a sense of what goes into constructing a test and some of the considerations you want to keep in mind if you do go on to administer a personality test, especially objective personality tests in the future. Okay, so the first approach is the content validation approach. And if you were to use, this is kind of like an old-fashioned approach. People would say, what do I want to assess? Maybe I want to assess how somebody's personality functioning. And so you kind of use theory to say what you think the major personality traits are. And then you define those traits and you consult experts. And then you can do some psychometric analyses, which I won't go into, but in case you're familiar with some of these tests, it would be like test-retest reliability, internal consistency, split half reliability. Again, if you don't know what that is, don't worry about it, but just in case you've encountered that, these analyses, this is what you would apply. Some issues with the content validation approach. First, it assumes that all patients are going to interpret the items in the same way, and this is just not true. Different people with different experiences, different backgrounds, and different ideas about what the test is trying to assess for will answer in different ways. It also assumes that patients can accurately report their own behaviors and emotions, and we talked about this before, how that's also not true, especially people with certain disorders are particularly prone to lack of insight into their illness, lack of insight into their behaviors and emotions and the reasons behind them. And also people in general, all people kind of come up with a story or a narrative as to why we act the way we act, or why we have certain emotional responses, and they're not always true. Sometimes they're just a story that's easiest for us to believe. Content validation also is dependent on a person answering honestly, and this is often not the case. People are sometimes motivated to exaggerate their symptoms for secondary gain. So if they're applying for disability benefits, for example, some people, certainly not most people, but some people applying for disability benefits are maybe don't have the disorder they're trying to convince you that they have. And it places a lot of trust in experts. So it's based off of people being experts in what personality is and the different facets of personality. And based on the fact that personality, our conceptualization of personality has changed so much over time and that so many people have different ideas of what personality is, this is a little bit shaky. Another approach is the empirical criterion keying approach, and I know the names of these approaches are kind of like, what does that even mean? So try to just focus on the description. In this approach, no assumption is made on the content of an item. So it's not like we want to, like if they want to assess for psychoticism, they ask, do you hear voices? Rather, what matters is what people in a diagnostic group tend to respond. So the MMPI, which we'll talk about a bit later, is a key example of this, the Minnesota Multiphasic Personality Inventory. And when this personality assessment was developed, they got a bunch of people in different diagnostic groups together and people who did not have any psychiatric diagnoses, and they assessed how they answered a range of questions. So maybe somebody with psychosis would answer really high on certain questions. Would there be a high rate of answering yes on certain questions and a low rate of answering yes on other questions? And so that kind of pattern of response would be considered characteristic of psychosis. And if somebody took the personality test, the MMPI, in the future and gave that same pattern of response, the personality test would say that that's indicative of psychosis. So it's a very empirical, very atheoretical approach, purely empirical actually, and not always rational. So it doesn't always make sense why certain items would load on certain personality factors. And this can make it difficult to interpret meaning. And we're going to cover this a little bit more when we talk about the MMPI. Another more recent approach is the factor analysis approach, which is based off of the statistical test factor analysis. It's used by a lot of test developers currently, and it's essentially looking at intercorrelations, so associations among different test items that create factors. So if you look at the picture on the right, you might have an item or several items that index good attachment and no guilt, and feeling like you have a high level of accomplishment and high self-confidence. And these items would all show correlation, which would then load on this factor of emotional stability. So you would have all these items that are listed on the left, and you would do a factor analysis on it, and the factor analysis would show that the top 4 and the second 4 and the third 4 are all correlated with each other, and then you just kind of like look at the 4 that are in there. So you just look at the second 4, for example, a person who likes parties, likes crowds, seeks out new experiences, and is entertaining, and you just kind of give it a label. So most people would consider that to be like extroversion. So that's factor analysis. There's 2 different types of factor analysis. Well, 2 main types of factor analysis. Exploratory, where you go in with no previous hypotheses about the factors. So you just toss those items into a factor analysis, those 12 items into a factor analysis, and whatever comes out is what you go with. Confirmatory factor analysis starts with the factors. So you go in saying, I theorize that my items will clump into the 3 factors of emotional stability, extroversion, and openness, and you're just confirming that that actually is the structure of your personality test. This is heavily empirically has a heavy empirical emphasis, but a downside is you're not sure if the items are actually measuring the variable of interest. So you don't know if the second for likes parties, likes crowds, experience seeking and entertaining is actually measuring extroversion. Maybe it's actually measuring something else like the fact that this person is in college, something like this. Finally, there's the construct validity approach, which is a combination of all these approaches. Scales are created to measure specific concepts that should reflect a theoretical construct, and then a factor analysis is done on this. So it's it's a theory-based, but also using the factor analysis, which is very empirical. Conducting tests of convergent and discriminant validity is a necessary part of construct validity, and then you use feedback. So there's kind of a feedback loop where you're creating this test and then kind of modifying based on the outcome of the psychometric tests that you're completing, modifying the theory, modifying the measure. It's labor intensive. You usually have to go through a series of studies to do this. It takes a long time, but it's probably the most desirable and creates the strongest psychometric properties, meaning the strongest validity and strongest reliability. So an example of the 4 different major strategies that we just talked about and how they might be applied to determining if an item on an inventory is valid. If you were trying to create an inventory item, so if you wanted to create a question on your personality test that loaded on depression, that was assessing for depression, in the content validity approach, and the item would be, I wish I could be happier. So this individual, when you take this test, you would answer true or false to, I wish I could be happier. And you're trying to use that item to assess whether somebody is depressed. In the content validity strategy, the item is valid if authorities, so experts in the field, say that that's valid and say that that's representative of depression. In the empirical criterion keying approach, the item is valid as long as it discriminates between depressed and non-depressed groups. So if you had 2 groups of people who you knew were depressed and non-depressed, that item would predict whether somebody fell into each of those groups. In the factor analysis approach, you would do a factor analysis and see if it was if that item was significant related to other items that measure depression. So in factor analysis, you would want the item would be valid. The question, I wish I could be happier, would be valid if it clustered together, if it was associated with other questions like I feel sad all day, and I sleep too much, and I never have any energy. Things that we know are associated with depression. Finally, in the construct validity approach, the item I wish I could be happier would be valid if it measured the depression construct as theoretically defined. That is, depression involves a negative view of oneself, and it's theoretically consistent that somebody who had a negative view of oneself wishes they could be happier. And then this would also be, in the construct validity approach, this would also be further validated by factor analysis. Now we're getting into some specific personality tests. The MMPI, or the Minnesota Multiphasic Personality Inventory, is one of the first widely used objective personality tests. It was first developed back in 1943, and no one uses the original one anymore. People use either the MMPI-2 or the newer version is the MMPI-2 RF. RF, I think, stands for revised form, which I prefer the MMPI-2 RF. It has some different ways of interpreting the items. It's kind of a huge test, so there are over 500 items in the full inventory. Sometimes you can administer the first 370, which is still a lot of items. That's still pages of true-false items. So the options are true, false, cannot say. This is empirical criterion keying approach, which we talked about a couple slides ago. The original intent was to identify psychiatric diagnoses. but it's used more frequently in recent times to assess personality traits. And there were some problems with the original form. There were some kind of ideological problems with it at the beginning that were reflective of ideological problems at the beginning of psychology, in the beginning stages of psychology and psychology as a science. So back in the 40s and 50s, in the original form, in the original version rather, there's a category called hysteria, and hysteria is what they used to call extreme levels of emotion in women. And the etymology of the word, the origin of the word is, I think it's womb, is what that means. And so the idea was back in the 40s and 50s and before that, the idea was that by the womb creates extreme and irrational emotions in women, and the name for this was hysteria. And it's a clearly sexist concept. People of both genders have extreme emotions. They might be expressed in different ways. So unfortunately, the MMPI still kind of has some reflection of this diagnostic term. So here are some examples of items like ones on the MMPI. In general, as I go through these tests, I'm not going to be giving real items from the test, and there are a few reasons for this. First, these are copyrighted, and so I can't share this. I don't own the rights. Another is that someday, in general, we try not to publicize what the items on their test are, because if people are exposed to the items before they undergo a psychological assessment, this affects the validity of the assessment. So in this graph, there are simulated items that are very close to MMPI items. And then on the left are clinical scales, and these are the real clinical scales in the MMPI. So hypochondriasis, which is like a hypochondriac, excessive concern with bodily functions. Depression, there's good old hysteria, although hysteria has been redefined to generalize more to both genders, but it still has kind of the sexist history. Psychopathic deviant is a really interesting one. It's a disregard of social custom, shallow emotions, inability to profit from experience. Interestingly, people with high education score high often on psychopathic deviance. And this is probably because, so the scale also loads on sort of like independent thinking and making decisions, moral decisions, based on one's personal morality and not necessarily social norms. And then there's the masculinity femininity scale, which some people question whether that's a little bit against homosexuality. So in previous versions of the MMPI, this was used to uncover homosexuality, which was, unfortunately, a while ago, considered to be a psychological disorder. And now it's more just like getting a sense of if somebody tends to be more traditionally masculine or traditionally feminine. Paranoia, psychasthenia, which is like OCD kind of. Schizophrenia, which is pretty close to what we actually think of as schizophrenia now. Hypomania, which would be low-level mania, and then social introversion. The MMPI, one thing that's really useful about the MMPI, and actually a reason that pretty much the only reason that I ever use the MMPI, is that it has validity scales. And these are scales that indicate whether a person may be over-reporting, under-reporting symptoms, lying in general. So the different validity scales, the question scale means like cannot say. So if they said if they answered cannot say to a lot of questions or didn't answer a lot of questions. The infrequency scale, it's called infrequency because there are certain items that very, very few people would endorse on the MMPI. Very, very few people would say, yes, that is me. on the MMPI, and so it's like infrequency of response, and if somebody, it's the F scale, and if somebody answers a lot of those, there's a good chance that they're faking bad, so trying to seem like they're suffering from more psychological problems than they actually are. There's the lie scale, which is, we also call it like, it's just a little bit different. It's a different type of lying, like saying I like everyone I meet. No one actually likes everyone that they meet. So that would, again, be kind of an infrequent response. The K scale, which is also interpreted sometimes as defensiveness, or a faking good scale. So this is where people try to present themselves in a better light than what might actually be true. An example of this would be saying yes to criticism from others never bothers me. Almost all people are bothered by criticism from other people. So if you answer yes to that, then this might be trying to present yourself in a better light than what's actually true. There are some validity scales that were added in the MMPI-2. There's faking bad on the second half of the test, so this is just another faking bad scale. The VRIN, the variable response inconsistency, is a pretty useful validity scale. There are questions embedded within the MMPI-2, or the MMPI and the MMPI-2, where where you would expect that somebody would respond similarly to both questions. So the two items are indexing things that are almost identical. So for example, if there's a question, I often feel depressed and my mood often feels low, you would expect that somebody would answer consistently either true to both of those or false to both of those. And if somebody is not responding consistently to a lot of those pairs, you might interpret that the person is responding kind of randomly to items on the scale. And the TRIN, which is the true response inconsistency, is just looking at the number of items that somebody responds true to or false to. So as I mentioned before, there are quite a few items on the scale, and people sometimes are just like, I don't want to do this. I just got to fill in all the bubbles so that I can get this done with. And the VRIN and the TRIN are trying to catch that and trying to make sure that we're not interpreting a personality test of someone that wasn't actually responding according to their personality. This is a little bit more information about the different scales. So there are two ways to score the MMPI or the MMPI-2. One is through computerized scoring, where you enter the answers into a computer. The other is manual scoring. Most people use computerized scoring because the manual scoring is a pain, although the computerized scoring is rather expensive. But this would be an example of the output from the computerized scoring. So at the bottom, on the x-axis, you have all the different scales, and then you have the mean scores, or the t-scores, on the y-axis going up. And in general, it varies on the MMPI-2 RF and the MMPI-2, but in general, like above a 65 is considered clinically relevant, and below a 50 is considered clinically relevant. And so anything kind of between the red and the green line is considered normal, and if you're higher than normal or lower than normal on a scale, that's kind of interpreted as this may be an issue for you in terms of personality. And there's a whole big booklet with all different types of interpretations for the scales, so it's a little bit complex of a process interpreting it. The MMPI has mixed reliability and validity. It has good test-retest reliability, meaning if I were to administer it to a person now and in maybe a month or two, it's likely that I would get similar results from the test. It does have some issues with validity, or the ability to actually assess what it's trying to assess. So for example, some of the scales may not actually measure what they're saying they measure. They might measure things that are correlated with what they say they're measuring. So for example, on the introversion scale, it may be measuring somebody's academic achievement rather than actual introversion. So maybe people who answer yes to a lot of the items are actually people who stay home and study a lot rather than being true introverted people. For example, that's just a hypothetical. The cutoff scores are also limited to, so the cutoff score is the like over 65, under 50 that I mentioned before. They're based on what we call like a normative sample. So they're based on individuals, what's normal for individuals in a rather small sample, in a rather limited sample. So it was over 1,000 men, over 1,000 women from Midwestern areas, and then some kind of like mid-Atlantic areas, and then California. And that's surely not representative of the entire US and only representative of people from the US. And the MMPI-2 is used outside of the US. It's mostly white and kind of not representative in general of the world population. The NEO PIR, so it's the NEO Personality Inventory Revised. NEO stands for the first three factors of the personality model. I'm not sure why, not all five, but it's developed from a model of normal personality. So the MMPI was developed from a model of abnormal personality, and this is more normal personality. So NEO is more appropriate for people who may not have severe mental illness, although it can be useful for people with severe mental illness as well. 240 items, less than the MMPI. Is a 5-point response scale, so it's dimensional rather than categorical, and this is a Likert scale. And it's based on this well-researched and well-replicated 5-factor model of personality, which includes neuroticism, extroversion, openness to experience, agreeableness, and conscientiousness. And this is a model of personality that has been tested in many different cultures around the world, many different types of people, and has mostly stood up. Some people find a 4-factor model, some people find the factors look a little different in different populations, but in general, this is a pretty strong model of personality, meaning these 5 aspects of personality pretty well describe most people. The NEO was devised based on the rational empirical model for creating tests, meaning it was devised through factor analysis and kind of this iterative or cyclical process of doing a factor analysis, testing it on a population, revising the factor analysis, etc. About half the items are reverse scored, and I won't go too terribly far into what that means, but essentially it's a way of sort of flipping the meaning of an item so that to make sure that somebody's paying attention. It's a kind of validity check. And then there's an additional validity check, which is not the best. So essentially you just have to, there are a few items at the end where the respondent has to say if they answered honestly, if they answered all the items, and then like checking the the examinee checks if all the responses were entered in correct areas. So it's kind of, it's not the best validity check. It's just kind of like a way to double check somebody's answers. The NEO has very good internal consistency and very good retest reliability. Also has good validity, and it may be relevant to both normal personality and certain psychological disorders, such as personality disorders, depression, and anxiety. There are 6 facets of neuroticism. So for each of the personality factors in the NEO, there are facets, and the facets are anxiety, anger or hostility, depression, self-consciousness, impulsivity, and vulnerability. And this individual scored pretty low, so kind of normal on a couple of them, self-consciousness and impulsivity, and really low on some other ones, particularly anger. That's a very low score on anger, which is consistent with this individual. I've never seen him angry. Extroversion, most people are familiar with extroversion. It's high social ability, someone who is highly sociable and gets a lot of energy out of social situations, versus an individual who would be low on extroversion is in a reserve. So this individual scored very high on extroversion, higher than 89% of the population, and this indicates that he's someone who's very social and very energized by social situations. And again, this is somebody that I know, a friend of mine, and I consider this person to be extremely extroverted. So there's kind of some face validity to the NEO that I really like. Face validity meaning it seems to measure what it says it's measuring. In general, the output of the NEO seems to map onto how that individual actually presents. There are 6 facets of extroversion as well: warmth, gregariousness, assertiveness, activity, excitement seeking, and positive emotions. And you can see in the breakdown of the subfacets that this individual is extremely high on several subfacets of extroversion and about moderate or average on 2 of them, assertiveness and activity. This is again consistent with his presentation. His level of social activity is lower, relatively lower than his gregariousness. He's a very friendly, very outgoing individual, but his social activity is a bit lower because he's a graduate student and he doesn't really have time to always be doing social activities. The third is openness to experience, which is kind of an unconventionalness, curiosity, versus someone who is very conventional, likes to adhere to tradition, and is relatively conservative in trying new things. So this individual was very high in openness. And there are 6 facets of openness: fantasy, aesthetics, feelings, actions, ideas, and values. These are different kind of like aspects of life or the world where someone may be more open or less open. And the individual comes up pretty high, very high on most subfacets, with the exception of actions. So he may kind of intellectually be very open and very interested and open in his feelings and his general values. He's not very rigid in his values, very open in his ideas, a creative individual, open in aesthetics. So he's someone who really appreciates art, but lower in actions. So he has all these kind of open ideals, but in terms of how he actually acts, he might be a little bit more conventional. Agreeableness is the 4th factor, and this is like an altruistic, sympathetic way of acting, kind of someone who gets along well with other people versus someone who is egocentric, acts on their own self-interest, and is more competitive. And this individual is extremely high on agreeableness as well. So there are 6 facets of agreeableness: trust, straightforwardness, altruism, compliance, modesty, and tender-mindedness, which is kind of an old-fashioned term. So this individual scored very high on about 4 of the subfacets of agreeableness, and pretty low on straightforwardness. And so it's a bit complicated in terms of the way that this is worded, but someone who is low on straightforwardness in the agreeableness category is actually high on straightforwardness. Because you can imagine that someone who is very straightforward, who says exactly what they're thinking, is maybe not the most sympathetic, or doesn't present as the most sympathetic or agreeable individual. Interestingly, this is a very nice profile for someone who is training to be a psychologist to have. And so this individual is no longer at the UH Manoa program. He's no longer a graduate student. He's graduated, but he was a very good clinician. And so he is someone who is able to say things in a straightforward way, but had enough of the other types of agreeableness, high trust, kind of high tender-mindedness, meaning he's just kind of a sensitive person, that the straightforwardness was kind of mitigated by these other factors. And again, this is a very nice profile for someone who wants to go into psychology to have. Conscientiousness is someone who is very purposeful and determined, organized, versus lackadaisical, unmethodological, maybe a little bit sloppy on the extreme end. This individual scored about average on conscientiousness, which is very interesting to me because I would perceive him as an extremely conscientious individual. And actually, this sort of highlights one of the limitations of self-report or objective personality measures, is that the individual is reporting their own perception of their personality. And so it may not map onto how others perceive them or how they actually function in the world. There are some personality measures that ask for, or that have a separate form for someone who knows the individual well to also rate them, and it can be interesting to compare that person who knows them well, so maybe their spouse or a sibling or close friend, and comparing that against how the individual perceives themselves. But in terms of the NEO, in terms of people rating themselves in personality forms, there can be, you have to keep in mind when you're interpreting it that it is their own perception of themselves that they're reporting on. And so this individual considers himself to be about average in conscientiousness. My perception of him would be really high in conscientiousness, but graduate students in general are extremely conscientious people. I'm going to make myself an exception to that. I'm not as organized as most people around me, but they're people who are extremely in graduate school often got there because they are extremely conscientious. And so this individual who rated himself as average on conscientious, it's possible that he was rating himself compared to the people around him, and therefore came up average. So there are 6 facets of conscientiousness: competence, order, dutifulness, achievement striving, self-discipline, and deliberation. And this person was like around above average on 3 of them. Moderate competence, which again is not consistent with how I perceive this person, who's extremely competent. He is faculty at a major research institute right now. Very competent individual. Lower on order, which may be true. This may be a factor where he's not terribly conscientious. And just for fun, there are some online personality tests that are based on the 5-factor model, which is the same theory as the NEO. They are not the NEO, and they are not validated. These personality inventories have not been tested as rigorously as the NEO has been tested. They're not for diagnostic purposes. I haven't really looked at the psychometric properties of these assessments. Not to be administered to patients. If any of you move forward in your clinical practice, please use and want to use something based on the 5-factor model, please use the NEO and not these other tests. But this is a link to one version. There are other versions as well, but this version seems to be relatively legit if you're curious where you would stack up on the 5-factor model of personality. I'm not sure if this test has all the facets. I think that's just the NEO. Yeah, so unfortunately, it's kind of a abbreviated version of a 5-factor personality test. So moving into projective testing, so there's objective testing and projective testing. We've been talking about 2 objective tests, the MMPI and the NEO. There are a variety of other objective personality tests. Projective testing is a procedure for uncovering a person's characteristic modes of behavior and personality functioning by observing behavior in a response to a situation that is not made to elicit a specific response. So when you're taking an objective test, there's a specific behavior or response that we're looking to elicit. It's a yes or no question, or it's a answer on a scale of 1 to 5. In projective tests, you're not choosing between preset responses. A person is responding in a sort of spontaneous way, and the clinician is trying to make judgments based off of that response. Examinee in a projective test has to kind of impose their own structure on their answers. The stimulus material is usually kind of vague or unstructured, meant to elicit a variety of responses. This method is very indirect. You're not asking someone, are you depressed? Or do you have these depressive symptoms? You're kind of gleaning from their responses that there may be depression. Client has a lot of freedom in their responding, and interpretation is much more complicated. You're dealing with many variables. The most well-known projective test is the Rorschach, and this is this ink blot test. Test. A lot of psychological assessment in the media will portray the Rorschach. There's different types of scoring, but essentially the administrator shows 10 cards. The card is shown and the administrator says, tell me what you see or what this might be for you. There are no right or wrong answers. Just tell me what it looks like to you. And then the clinician writes down what the respondent says verbatim. So exactly what the respondent says. And after they administer each ink blot, the clinician then asks what in the blot prompted a response, and asks for the exact location of the response. So it's a respondent might just be responding to part of the ink blot, for example. This is not a real Rorschach ink blot, so I have a couple pictures of ink blots that are inspired by the Rorschach but are not Rorschach items. And again, that's because the Rorschach is copyrighted, and because if any of you were to take a Rorschach test in the future, I wouldn't want to affect the validity of those responses by showing you images now, by kind of priming you with these images. So in Rorschach scoring is very complicated. It takes a lot of training to do the scoring, but in the scoring, the examiner is interested in the location, as I mentioned before. So was the person responding to the whole ink blot, to a large detail in the ink blot, small details in the ink blot? Sometimes people will respond to the white space rather than the black space, or the Rorschach is both has images that are colors and images that are just black and white, and so are they responding to the colors? Is that part of the colors or the black, or are they responding to the spaces in between? The content of the response, possible determinants of the response, whether they're using popular answers. So sometimes individuals will respond what they think should be the answer rather than what they actually see. And there's one scoring guide that's kind of, as best I understand, most favored by individuals who use the Rorschach, and that's the Exner Comprehensive System of Scoring. It's a research-based approach based on psychometric data, so meaning there were samples of people that were studied and kind of like normal responses, and then a variety of maybe abnormal responses were observed based on this. So this is an example of how the Rorschach might be scored for an individual item. This case illustration is not based off of that picture. I just had the picture there kind of a reference for what you might be looking at, what type of thing you might be looking at. So for card 1, the individual, which is an 18-year-old college student who doesn't have any diagnosed mental illness that we know of, male, the individual responds, this looks like a crab or a sea animal of some kind. And then the examiner might kind of inquire, what makes you see that? What do you see? And then the individual says, claws make it look like a crab. So the individual might see claws somewhere in here. And kind of just purely coincidentally, I could kind of see a crab in this ink blot. And then on a different card, a card later, card 8, the response might be a flower of some kind, possibly an iris. The examiner inquires for further response, and he says the petals have that shape and the colors of it, I guess. So this individual responded to the colors. In the scoring of these 2 cards, the examiner, it's complicated, but there are these letters that indicate different types of responses. So in the first card, the individual responding to large details, the good form, like the whole form, and they responded that it was an animal, which in the Rorschach scoring system, in the Exner scoring system, seeing an animal means something compared to seeing an inanimate object. And for the second card, for card 8, the respondent was responding again to the whole card, the form over the color. So this card 8 was a card with color, and they were responding predominantly to the form, less to the color, and they saw a plant, which means something in the Exner system. So I will divulge that I am pretty strongly against the Rorschach for any kind of diagnostic purposes, and I think there's good evidence for this. In the UH Manoa Clinical Psychology program, we tend toward objective tests of personality. I think that projective tests, such as the Rorschach, have some utility. They can be useful in clinical practice, but I do think that there are problems with the research base and problems with validity and reliability within the Rorschach. So there's mixed data, and there's a lot of controversy over whether there's the Rorschach has good reliability, good inter-rater reliability, and test-retest reliability. You can imagine how challenging it would be for two individuals to rate responses similarly. There are just so many factors, and it's, to me, there are some broad leaps that are taken in saying that because a person sees an animal, their personality functioning is in a certain way. There could be so many reasons that a person would respond that something is an animal rather than an inanimate object, and I personally find it a little suspect to interpret that too far. In general, the Rorschach doesn't have as much research on it as other measures do, possibly in part because it is challenging rather to research projective tests. So there lacks retest studies, and there's no support for incremental validity. And I think this is really the clincher. So incremental validity means, does the Rorschach provide information that an interview or other personality tests would not be able to elicit? And the answer to this is pretty clearly no. So the Rorschach takes a lot of training. Somebody must be highly, highly trained to use the Exner system. It's complicated and it takes a long time. And there are other tests that give you the same information, likely even more information, in less time and in a more reliable and valid way. So part of that is my own soapbox about the Rorschach, but a lot of that is based in research as well. But I completely encourage people to examine the issue themselves, look at the research, look at the evidence, and kind of think about to what degree you feel like the Rorschach is appropriate in clinical settings. Another projective test is sentence completion, and there are a variety of different sentence completion assessments, but essentially they all comprise of these sentence stems, so these kind of prompts, and the person being assessed finishes the sentence. It's projective, but it does have some relatively objective scoring, and it doesn't necessarily provide evidence that's not gained in an extensive interview, but it can be interesting. And this is one that I've used in my own clinical settings, and have found to be not diagnostic and not a comprehensive assessment of a person's personality, but sometimes can be used if you're kind of like stuck in a clinical situation, if you feel like you just need more information about this person, or it can even be used as kind of like an icebreaker. Clients usually find this to be a pretty palatable or like easy test to complete. Okay, so this material now is information that was not in your book. This is additional information about assessments for personality disorders, and these I'm going to talk about 2 personality assessments that were derived from the DSM-5, and this is not in your textbook. So there's the structured clinical interview for the DSM-5 personality disorders. We talked about this before when we talked about the DSM categorizing psychological disorders and semi-structured interviews. So this is a structured, but really more semi-structured clinical interview based on the DSM-5 criteria for personality disorders. It's objective. It's categorical, a clinician administers it, and it has the same format as the SCID-5. So this is an example from the regular SCID, not the SCID for personality disorders, because I just couldn't find a picture of the SCID for personality disorders. They guard the information pretty carefully, because again, it's copyrighted, although this should be copyrighted too, but somehow I found a picture. Anyway, so it's kind of this choose your own adventure format where the clinician reads these prompts that are based on criteria for the personality disorder, answer yes, no, and depending on whether the response was yes or no, it tells you where to proceed. So it's a very structured way of going through the diagnostic criteria for personality disorders. And then there's the PID-5, the Personality Inventory for DSM-5, and this is a dimensional rating scale for personality disorders. So if you remember again a couple lectures back when we were talking about classifications of mental disorders, we talked about how personality disorders in the DSM-5 are traditionally rated according in this categorical way. Either somebody has borderline personality disorder or they don't. Either they meet a criterion for borderline personality disorder or they don't. And then there's this newer way, the dimensional classification system, which is based off of this personality inventory, the PID-5. Where somebody kind of has different levels of different personality facets, different personality domains. So the PID-5 is an objective test based on a Likert scale, again based on this dimensional model of personality disorder, and it's still relatively new. It needs more research, and that's kind of how the people who developed the DSM-5 have presented it as this measure that can be used, but we don't know exactly how to use it yet in all situations. So examples. This is from the actual PID-5, so this is available on, freely available on the internet. I've also included it in your optional resources section of the La Lima page. And some examples are of items that might be included are I don't get as much pleasure out of things as others seem to. Plenty of people are out to get me, which is indexing paranoia. People would describe me as reckless, indexing impulsivity. I feel like I totally act on impulse, which is another impulsivity measure. And somebody rates if it's very false or often false, all the way up to very true or often true. Clinician rates it. And then the PID items are included on, are kind of like summed up. And so these are examples of some of the personality trait facets. I didn't include all of them just because I would have made the text too small. But so example for anhedonia, which is like a lack of feeling pleasure. Item 1, item 23, item 26. Item 30R means it's reverse scored. So you take the opposite of that score. If they answered a 5, you would score it as a 1. And so you put, you kind of add all those up and you get the average facet score. And this would be an example of the somebody's results. So for anhedonia, this individual, the red looks like it's high scores. The yellow looks like it's like moderately high or average, and then the uncolored scores are on the lower side. So this individual is very high in anhedonia, very high in anxiousness, and pretty low in looking kind of down the list. It looks like they're pretty low in intimacy avoidance, so they don't avoid intimacy. And you can see how there are a lot of different personality trait facets that would load onto certain personality disorders that are could load onto personality disorders. So for example, somebody who has borderline personality disorder, which is you probably know is a disorder characterized by difficulty with somebody's sense of self, difficulty with emotion regulation, so extreme dysregulation of emotion and kind of a lot of turmoil in interpersonal relationships, you would expect emotional ability to be very high in that individual, and you would expect impulsivity to be very high in that individual. So there are structured ways to take the information from the PID-5 and understand if somebody may be either at risk or manifesting a personality disorder. Okay, so this is again not included in your chapter. I think you guys voted against covering intelligence testing, which I completely understand. I don't think it's very consistent with a lot of what you plan to go into, but I think we can't have a clinical psychology class without including at least a brief note about assessment of intelligence, because it's a big part of a lot of what clinical psychologists end up doing. Also, it's kind of interesting, and I would love for you guys to come out of this having some information about how intelligence testing can be used and how it shouldn't be used. Also, if you were, I took this information at least partially from chapter 7, which was our intelligence testing chapter. We're not going to cover it in this class, but if it's something that's particularly interesting to you, by all means read chapter 7, and I'm more than happy to answer any questions about it. So, in assessment of intelligence, the most common assessment these days is the Wechsler Adult Intelligence Scale, and we're in the 4th version of it, so the WAIS-4. There's a version for kids or people under 18, which is the WISC, and we're on the 5th version of the WISC. What you get out of the WAIS is a full scale IQ, so that's like when people talk about their IQ scores, that's what they mean. It's this full scale IQ, and most of the time that's based on the WAIS. And then there are subdivisions of different cognitive domains within the WAIS. And so an example of a subtest, so there are a number of subtests, I think like 10 subtests, and then some alternative or additional tests that you can administer. An example of a subtest would be to the right, this visual puzzles subtest, where you have to use 3 of those pieces at the bottom to create the piece up top. So kind of like looking at like perceptual reasoning. So this is the breakdown of how full-scale IQ is derived. At the very bottom, in the little dotted line boxes, you have the individual subtests. On the far left, vocabulary, similarities, information, and comprehension are subtests that would load on the verbal comprehension index. And then arithmetic, digit span, and letter number sequencing are working memory tests that are verbally administered and verbally responded to. And so the verbal comprehension index and the working memory index both load on the verbal IQ. And then on the right, you have the subtests that load on the perceptual organization index and the processing speed index. And those both comprise the performance IQ. And then verbal IQ and performance IQ comprise your full-scale IQ. The average IQ score in all IQ tests is 100. So, and then scores after that were based on kind of like standard deviations from 100. So 15 IQ points is a standard deviation, which I hope you remember from your statistics course. If you don't, just don't worry about it. I hope you learn about it in the future. But 15 points up is a standard deviation. 2 standard deviations is considered like abnormal. I say abnormal, I don't mean that to be a negative thing. It's extreme. So 2 standard deviations, or 15 IQ points times 2, or 30, would be 70. So scoring below 70 on an IQ test, it's considered kind of extreme or significantly different from the average. IQ score below 70 is typically considered a criterion for intellectual disability, along with other criteria that are necessary for a diagnosis of intellectual disability. But when someone scores kind of between the 70-80 range, we usually say that's like borderline intellectual functioning, and then below 70, there starts to be significant disability from intellectual functioning. And then above 100, so 30 points above 100, 2 standard deviations above 100 is extremely high. So if you have an IQ score of 130 or above, this is really like your college professors and a very low percentage of the population. So you can see as well kind of in the first section under this normative curve is the percentage of cases that tend to fall into these areas. And this is true of all normative curves, but it's of course true of intelligence. Intelligence assessment is based on normative curves. And so about 50% of the population falls between 90 and 100, 90 and 110. And then people that are below 70 or above 130 fall into 2.2% of the population. There's a really interesting effect called the Flynn effect, which is the observation that the average IQ within the US has increased, or has been significantly increasing by 3 points every 10 years since 1972. So an average person now scores maybe 12 points higher than an average person back in the 70s. And it's not clear what underlies this. It may be that we're getting smarter. It may just be that we're better at taking cognitive tests. So it may be that cognitive type tests are more part of our educational system than they used to be, and therefore people are getting better at taking them, or more familiar with them, and score higher on them. This underlies the importance of using kind of a contemporary sample for IQ tests. So every new version of the WAIS, we're on the WAIS 4, every new version uses a population, a current population, so that to kind of in part combat the Flynn effect. This is just another depiction of the normative curve, of the bell curve, with some kind of text boxes that I thought were kind of useful. So 95% of people fall within 30 points of 100. So the vast majority of the population falls between 70 and 130 on an IQ score. So when you hear people saying that they score, look up at the top, the higher level rather, so the rightmost tail of the normative curve, and you see a score of 145, which is almost a perfect score, I think, on the WAIS, is associated with is present in 0.1% of the population. So when you hear people say things like, I have an IQ of 162, I was just watching a TV show, I think the other day, where somebody claimed to have an IQ score of 162. I don't even know where that comes from. You can't even get that score on the WAIS. And so also reliability of high IQ scores, because there's just a smaller percentage of the population that these normative scores are based on at those tails of the normative curve. It's very unreliable up there. So I would say like 145 is kind of the max that we can be sure about in terms of IQ scores. If you hear people saying they have an IQ score of 150, I really question the validity of that, and I question whether they just took one of those online IQ tests that make everyone look like a genius.